The Mona Lisa Touch laser treatment is a revolutionary new treatment that involves utilizing a fractional carbon dioxide laser in the vaginal canal. This therapy is game-changing. Prior to this coming to market or being available to women, all you had to treat these common disorders of atrophy of the vagina and the vulvar skin was hormones. And hormones, unfortunately, have a lot of negative effects. This laser specifically treats a very common problem that we term vaginal and vulvar atrophy. In general, when a woman passes through menopause, she loses her circulating estrogen. As that occurs, the vaginal and vulvar skin, the vulva is nothing more than the skin around the vagina, become dry and thin and very sensitive. Probably 40 to 50% of women that pass through menopause start to suffer from the symptoms of atrophy. Specifically, these include vaginal dryness, pain with intercourse, irritative symptoms of your bladder such as urgency and frequency and pain when you urinate, and just an overall irritation/pain in that area. The laser is an amazingly simple office procedure that addresses this in a very effective and efficient fashion. The laser was developed in Italy. I was fortunate enough to be the first physician in the United States to actually study the utilization of it here on American women. Myself, in conjunction with a colleague of mine from Stanford, did the first US trial. I've now treated hundreds of women off protocol with this treatment. I continue to be amazed at how well this very, very simple treatment works. Women that have not been able to be intimate because of problems with vaginal atrophy all of a sudden have regained a life with intimacy with their husband or their partner. The patients that are most likely to benefit from the Mona Lisa Touch laser treatment, first and foremost, are going to be patients who have passed through menopause. 40 to 50% of those women will start to have the symptoms of atrophy. Historically, estrogen therapy or hormone therapy has been given, so patients who either don't want to take hormones or have not had the success that they'd like with hormones are excellent candidates for this. Women that have had breast cancer, unfortunately, as you're probably well aware, most of these women can't take any hormones because of their breast cancer. Prior to this treatment, there was very, very little we could offer these women. Now with the Mona Lisa Touch laser, they can regain the ability to have sexual relationships and get rid of that constant pain and pressure that has occurred because they've lost their estrogen or they've been placed on a medicine that basically knocks out the estrogen in their body. So this is very well received in that subgroup of patients. Finally, women who have had surgery that required the removal of their ovaries at a younger age, someone who's had a tumor or a cancer of their ovary, somebody who's had a condition called endometriosis that's required removal of their ovaries, or a variety of other conditions. Again, those patients are abruptly put into a state of menopause and are excellent candidates for the Mona Lisa Touch laser treatment. So currently, the treatment regime that we utilize in a patient that has vaginal atrophy is basically 3 treatment sessions that are done at 4 to 6 week intervals. In general, that results in a significant improvement or even a curing of their symptoms for probably at least a year in most patients, or maybe even longer. If and when some symptoms do recur, we're only having to do 1 treatment session to get them back to where they were after the 3rd treatment when they were initially treated.